Hi everyone. Good news. Our face-to-face classes will be returning next Monday. It seems we are finally transitioning from pandemic to endemic. Welcome to our science lesson about endemicity. Endemic is a term that has been used by public health experts to describe how the future of COVID-19 will likely go.
Does endemic mean that the coronavirus is becoming more benign?
Good question. Let us watch to what experts are saying.
So a pandemic is when you have an epidemic spread of a disease across large regions in the world, such as what we're experiencing now with Omicron. That's affecting large numbers of people and causing not only large numbers of infections and cases, but what we care about is hospitalizations and deaths. An endemic disease is where you have a stable number of people over time that are being infected. So you have continuous transmission, and you may have peaks and valleys.
According to the Centers for Disease Control and Prevention, an endemic is characterized by the constant presence or the unusual prevalence of a disease or infectious agent in a population within a geographic area. Other endemic diseases include HIV and tuberculosis, but categorizing viruses as endemic can be murky, like when it comes to influenza.
The one issue that comes up is that not all endemic disease is the same. You could have high-grade endemic, high endemic transmission. You could have mid-endemic transmission and low endemic transmission. A good example of high endemic transmission is influenza.
Endemic, to me, again, means different things. I think about viruses or pathogens that are endemic to certain regions, meaning that they're specifically localized in certain places. Flu, to me, is not endemic because you find it globally, right? It's all over the world.
But what does it mean when a virus like COVID-19 becomes endemic? That can be unclear, even among global health experts.
COVID's probably not going to go away. We're probably going to have to contend with it next fall and winter, I think, for the foreseeable future, for the spring and the summer.
It's not going to go away in the US. It's not going to go away in Europe.
I'm eager to hear your thoughts about this shift from pandemic to endemic. Why don't we just start by talking about what's that mean?
Yeah, and good to be with you, Todd, and talking in the context of a lot more people being actually vaccinated today than what, of course, was possible back in 2020. What I think of when, as an infectious disease specialist, an endemic, it means that the disease is still around, but it's at a level that is not causing significant disruption in our daily lives. That being said, endemic disease can be at different levels. And of course, we've lived with endemic diseases in the past, right? We've had measles, mumps, rubella. Before we had vaccines available, those were endemic as well. And what's different about COVID-19 is that we do have a choice now about the level of endemicity. So endemic diseases can be at high levels, or they can be at lower levels. And so where I think we're at a crossroads is that we have an opportunity to actually get that to a lower level, manageable level, where we're not getting impacted in our hospitals, not having to close down schools, close down businesses. And that really is through a combination of a concerted effort around testing, vaccination, isolation, quarantining, that looks a lot more normalized than what we've had to do over the last 2 years.
It is much more complicated than I thought.
Let us investigate more deeply. Elaborate at least one claim relevant to the relation between pandemic and endemic that most strikes you.
This sort of debate about endemic and pandemic has really become, I think, a vocabulary debate a little bit. I think this concept of what is the end game is way more important. And like understanding what does our end look like is much bigger than a single word. It is what is our reality moving forward 2.5 years into this.
I think this is really a question of semantics to some degree. I mean, pandemic means it is around everywhere in the world, which is the situation we're still in, whilst endemic means that you find it in the environment in which you find yourself in a particular country. And I think as far as the UK is concerned, this virus is now already endemic, whilst it is also still part of the pandemic. I mean, I'm not the person who's setting these definitions, but I think, what people need to perceive is the exposure to the virus on a regular basis, be it seasonal or not seasonal. And I think that can be described as endemic. And we already are seeing this. We're now 18 months into this new virus, and we're seeing these troughs and peaks on a regular basis. And I think that's a sign of endemicity.
Nice.
Now, a new subtype of the coronavirus has been detected near Shanghai. It is something that the world hasn't seen before. China's massive outbreak is already making the world nervous. It could fuel another major outbreak in other parts of the world. China's own response is also weakening the global fight. More in this next report.
It is not over yet. The Wuhan virus has morphed again. A new subtype has been detected in China. It has been named BA1.
COVID lockdown, Shanghai style. 26 million people, by some measures the biggest city in the world, confined to their homes. But breaking through the silence, drone instructions.
On COVID-19, there is good news. Last week, the lowest number of COVID-19 deaths was recorded since the early days of the pandemic. However, some countries are still witnessing serious spikes in cases, which is putting pressure on hospitals. And our ability to monitor trends is compromised as testing has significantly reduced. At present, there are a number of Omicron sublineages we're following closely, including BA2, BA4, BA5, and another recombinant detected made up of BA1 and BA2. This virus has over time become more transmissible, and it remains deadly, especially for the unprotected and unvaccinated that don't have access to healthcare and antivirals.
Ready? Let's go.
Welcome. Let's listen to your claims.
Endemic means that the disease is still around, but at a level that is not causing us a significant disruption in our daily lives.
What is interesting about the COVID-19 is that now, we do have a choice about the level of endemicity.
The problem is that we don't know how the virus will continue to evolve. We need to be vigilant. Have you seen what is happening with Zero COVID plan in Shanghai? Can you imagine people being instructed to control their soul's desire for freedom?
The fact is that we're still facing the reality of pandemic. There is no point in kidding ourselves. At the same time, we feel to be exposed to the virus on a regular basis, with ups and downs. This condition signs to endemicity.
Right, it signs to endemicity, but this doesn't imply that the relation between pandemic and endemic is one of transition.
Fine. To live in a pandemic world and simultaneously to feel exposed locally to endemicity may seem like a contradiction. How to solve the riddle? This will be the topic of our next class.